Dear colleagues, my name is Renat Akhmerov. I am a doctor. I am maxillofacial plastic surgeon, and I have some science degree. I work as a collaborator professor in New Vision University in Georgia. I'm developer of plasmolifting technology, and so I have some publications about plasmolifting. Today, most researchers and healthcare professionals intend to regard plasma in the context of its therapeutic use of autologous tissues. It depends on your way of thinking about what does it mean blood inside of us. We have to know that blood is an organ or the tissue, but not official drug, not official medicine. And when you think about plasma as an organ, as a tissue, you have to think about autologous transplantation. And it will solve all clinic situation in your practice. Of course, we talk about platelets. Platelets are a component of blood which, along with leukocytes, blood white cells, contributes to hemostasis and plays a crucial role in tissue regeneration. Furthermore, platelet proteins have been reported to exhibit antibacterial, analgesic, and anti-inflammatory properties. And there are many very famous doctors who supported autochemotherapy as a method of treatment before antibiotics era. But the very important was for us Paul Raveau, a French doctor who gave the name autochemotherapy. But also I have to emphasize that in the United States, there are a lot of doctors, two doctors from Sweden, Elfstrom and Grafstrom, they treated pneumonia, they treated pneumonitis after tuberculosis. Gilbert, Beer, Jeff Spithoff in England, all over the world, people used autochemotherapy very successfully. Perhaps in part due to the lack of universally accepted explanation, we hadn't explanation for the reported beneficial effects of autochemotherapy, and certainly in part as a consequence of the advent of antibiotics, vaccines, and other pharmaceuticals, the interest in classical autochemotherapy has declined and virtually disappeared. So, and moreover, usually I add one thought during my lecture. When we used autochemotherapy, there were not any benefits for doctors, for pharmaceutical companies, and for anyone. That it was not priceless, but the prices for autochemotherapy were very, very low. This is a reason that we didn't use, Spreadler didn't use autochemotherapy. Autologous plasma therapy involves the injection of the native plasma into tissues. That's very simple. But it's used to initiate regenerative processes, especially in aesthetic medicine, to treat muscle spasms, to produce analgesic effects in rehabilitation, in traumatology, in neurology, of course, anti-inflammatory and antibacterial effects, and to serve a prosthetic function. For example, I can use the example of the treatment of knees, of arthrosis. Moreover, I postulate that the injection of blood plasma mimics, it's a very important thought for me, mimics the pathophysiological processes involved in the bruise formation. When we make injection of plasma, we produce the mimicry of the bruise, not hematoma, the bruise. This is a stress, of course. This is a stress for the tissue. And now you see the slide which shows us what we have inside of lesion, inside of trauma. We have fracture, we have rupture of vessels, and we have bruise. This is very simple. And the next slide, consequently, we have a stress. We have a stress and we produce stress, the small stress, very useful, but stress for our tissue. And here in Russia, I deliver a lot of lectures, not only standard lectures, about the prophylaxis of our immune system against coronavirus. And this is a very simple. When we make the stress by autologous plasma injection, we can improve our immune system. This is a very simple and takes the source from autochemotherapy. So the injection of autologous plasma induces tissue stress. According to our knowledge from the medical school, we know that human being body needs every time stress. And the creator of this theory, Gansillier, and we know him, of course, and the chronologist and stress researcher, has defined stress as a non-specific response of the body to any demand made on it. According to him, stress is unavoidable, and in fact, it would be undesirable to avoid it. I have often said that stress is the spice of life. It can be a great stimulus to achievement. In other words, stress is necessary and even beneficial for life. In this way works plasma. From our course of biochemistry from the medical school, we remember that blood consists of three parts. In our tube, we see in upper part plasma, of course, red cells, and in the middle we see the platelets, monocytes, lymphocytes, and as an English term of it is a Buffy coat. You should remember this term from our medical course. And of course, this is a biochemical point of view for the plasma implementation. You can see here the platelets, monocytes, lymphocytes. That's a very interesting for me to describe some aspects of plasmolifting, of plasma implementation from this slide. For example, you see platelets. Of course, we use platelets. Monocytes, non-specific immune response. We have plus 20% of monocytes every time, just after 3-4 days after plasma procedures. And of course, lymphocytes that we use, of course, also in our technology. I mean PRP. Any type of tubes, any type of treatment are equal. Differs are only in protocols, in your knowledge about PRP plasma implementation. So the first spin separates the red blood cells from the plasma, which contains the platelets, the white blood cells, and the clotting factors. And of course, in order to escape coagulation, we use anticoagulant. In Europe, we use, plasmolifting technology, we use citrate. In Russia, we use here heparin. I think that there is no difference in therapeutic effect between heparin and citrate, of course. And but according to legislation, we must use citrate in Europe, in the United States too. So the platelets may be activated by any environmental perturbation, including mechanical stress. The most important physiological stimuli for the platelet activations are collagen, thrombin, ADP, and thromboxane. Upon activation, the platelets gain the capacity of adhere to the injury site, platelet adhesion, and to interact with the ligands, platelet aggregation, forming a hemostatic plug. Moreover, the platelets participate in the activation of the coagulation cascade through various pathways, including exposure of procoagulant membrane, phospholipids, and secretion of alpha granules. What do we mean by platelet activation? But usually, this is a normal notion from the pathology, from the physiological and pathophysiological viewpoints. This step is a normal platelet response to removal or injury of the endothelium and to contact with subendothelial structures. Simply, when platelets loses the contact with endothelium, it's activated. The next slide. And now on the next slide, you see how can be activated, must be activated every time. Platelets and other part of plasma must be activated in our practice. And the next slide, please. Growth factors. Of course, my colleagues usually insist about the importance of growth factors. So, and you can see here some type of growth factors, epidermal growth factors, platelet-derived growth factor. There are a lot of growth factors that we know, and probably there are a lot of growth factors that we don't know. I mean, they're fundamental medicine.
As a doctor, I'm more comfortable using butterflies. The needle goes into the vein, and immediately here in the catheter I see blood. In other words, I immediately get a visual confirmation that the needle is in the vein. So I calmly connect the test tube here. First the blood flows, then drips, then stops. I disconnect the first tube and connect the second. The cap allows us to connect the tube evenly, and we therefore escape any possible complications because of blood dripping from the catheter. If you connect the tube unevenly, you will unfortunately tear this elastic band, which closes the needles that goes into the tube, and thus blood will be dripping all the while you are changing the tubes. So please use all specialized equipment in order for the procedure to be comfortable for both you and your patient. So most often you fill the tube with the blood up to the top of the label, and then you need to put it in a centrifuge. In the centrifuge we always put an even number of test tubes, that is 2, 4 or 6. If you suddenly have an odd number of test tubes, 1, 3, etc., then you need a counterweight. It is easy to make one. You just take one test tube from the box, open the lid, fill it with distilled water, close the lid and keep the tube in a drawer near the centrifuge. When you have an odd number of test tubes, put in a counterweight so that the centrifuge is balanced. The following centrifuges are currently recommended for the procedure. EBA-20 and EBA-200 are manufactured in Germany, with centrifuge blood in it at 3,200 rotations per minute for 5 minutes. ELMI CM6M is manufactured in Latvia. The mode is 3,500 RPM for 5 minutes. There is ApexMed model 82S or 80S, that's 3,000 RPM for 5 minutes. And finally, a Russian-made CM6 centrifuge. The mode is 3,000 RPM for 5 minutes. Each centrifuge has its own angle of inclination of the rotor, that is, in some centrifuges you put test tubes at an angle of 15 or 45 degrees, in some at an angle of 55 degrees, and in some at an angle of 90 degrees. Because of this, the isotropic gel in the test tubes will be distributed either at an angle or evenly. It is important to observe the required modes of centrifugation. If, for example, we do not set enough rotations, the gel will not work. As a result, after centrifugation, we will get the gel at the bottom, and on top there will be plasma with red blood cells and occasionally with white blood cells. On the other hand, if you centrifuge blood at a very high speed for a longer period of time, you will filter out most of the substances that we need, so basically it's as if you were injecting the water. This is how we inject autologous plasma. Nearly always we work with Louis-Locke syringes, that is the syringes where we screw the needle on. We sell 2.5 and 5 ml syringes. They are very convenient as the needle does not come off during the procedure. You can use fairly thin 30G, 32G, 33G mesotherapy needles. If I work on the body, I choose a 5 ml syringe, and on the face and scalp I prefer 2 or 2.5 ml.
Immune-boosting properties of plasmolifting. Due to its rich components, plasma is a natural healing agent in the body with a wide variety of options for different tissues and types of damage. Unlike transplantation, when the immune system rejects any other invasive organism and their parts inside the system, plasma is taken from a patient and is given back to the same patient, which cancels any negative immune reactions. Due to the separation procedure during centrifugation, all red blood cells are bonded with the plasma gel, so plasma is ready to be received by the body without any interruption. Platelets are given directly to the place of damage, for example during inhalation through nebulizing into the lungs, and are ready to be received by the body without any interruption. Platelets are given directly to the place of damage, for example during inhalation through nebulizing into the lungs, and are activated immediately. This leads to a non-specific immune response that helps to treat the virus. Intravenous, intramuscular, and inhalation introduction of plasma starts the cascade that leads to an increase in monocytes, which become, in its time, a macrophage. These aren't affected by a virus and therefore activate a natural immune capacity to recognize the invader. Such a strong immune response will keep in a place for at least a month or longer. Such a strong immune response will keep in a place for at least a month or longer. Alopecia, streptococcal impetigo, eczema, psoriasis, ulceration, and many more.